Thank you for inviting us. The discussion that you're having on health care and what we have to do to continue to provide health care that's more accessible and affordable for everybody is a dialogue that we have to have and continue to have. So I thank the Iowa caregivers for having us this opportunity, and my distinguished colleagues up here who I think sometimes feel they see too much of me. I certainly don't see too much of them. These are the experts. These are the people that are delivering the service, and many times they are the people that sometimes get unduly criticized for the system that we have. Last year we passed House File 2539. This year we're working on Senate File 48. In both situations, both bills, it's designed to create a better health care system for Iowans. We started 2 years ago with a commission that had 29 members of this community of Iowans, included Governor Branstad and Governor Vilsack, who conducted 3 public hearings for us. And the first public hearing, and I tell this story because it's so indicative of the change in culture. Governor Branstad, well, before I tell you that, I was sitting with Governor Branstad and Governor Vilsack and Majority Leader Groundstal. Just about to begin, Governor Vilsack leans over and says, "Introduce Governor Branstad first. He's the longer-serving governor." So it was very nice for the Governor Vilsack to do that, and so I did. I wasn't quite sure what we were going to get out of Governor Branstad. He is president of a medical college now, so I knew that he would be sympathetic. But he was asked to conduct these 3 public hearings with Governor Vilsack because he was a Republican former governor. But he got up, and the first thing he said made him sound more like Senator Tom Harkin than the old Governor Branstad that I knew. And he got up and said, "We have a sick care system, not a health care system." And from that point on, I just felt so encouraged by the kind of attitude we were going to have, not only that night, but the subsequent nights, the 9 months of open hearings we had as a commission, and subsequently the kind of dialogue we had last year. And I see Representative Wise here, who participated in that dialogue and supported it, and along with the bipartisan support of the legislature. But the story here is there's so much to do. And what we did with the direct caregivers was an example of how far down, I don't mean that say that in a structural sense of importance, but how far we dug to understand the healthcare system we have. And we found out that 30% of the direct caregivers who work in nursing homes don't have health insurance. It then started painting a picture that we could visualize. That when we started talking about how bad our system was, we started thinking, here, the people who are taking care of our parents, grandparents, can't afford health insurance. And then we kept on finding other trends. We kept on understanding the need of the special needs of our children and our adults. We understood how difficult it was to get insurance, keep insurance, and then then have the expectations that you're going to be covered when you need insurance. And in the end, we passed a bill, 94-4 in the House and 42-4 in the Senate, that not only was good for us, but it's a national leader. I testified in front of Senator Kennedy's committee 3.5 weeks ago at the invitation of Senator Harkin, but the essence was, come and tell us what a state is doing and how you are approaching health care reform. And in that testimony, I can tell you that as a person that sat on the other side of the table for 6 years, I have a newfound respect for people testifying in front of our committees. It's a little intimidating, but I knew I had 5 minutes because they have a little clock in front of you. And I'm sitting there with 4 other participants, and they had to speak in 5 minutes. And so I knew I had to choose my words very carefully. And so I did what I do best, and that is I didn't prepare anything. If I was going to be fair and open to these senators, I needed to tell them what I felt, not just what I wrote down. And so I felt a testimony that presented a fairer explanation of our system. I told them they failed. In 60 years of saying they were going to reform health care, they haven't. I told them we failed, that as politicians we campaign on reforming health care, and we never have. And then I said, now we have an opportunity to do it right. And they were very interested in what we were doing and the comprehensive nature of it. And Senator Harkin, after the testimony, we had breakfast the next day, and I showed him the bill that we were going to submit this year, Senate File 48. It was 86 pages long, and he looked at it and he said, well, how long is it going to take you to do that? And I said, 3.5 months. He said, you're going to get all that done in 1 year? And I said, I got a bill twice this size done last year. I said, people are ready, Senator. People are ready for reform. And the reason I'm late today is because we just had our 5th subcommittee on House File 48 that had over 14 people testifying. And people are beginning to understand that we can do it. We can give directions to our state agencies. We can set policy for insurance companies. We can ask doctors and other providers to be more engaged in a state policy, that their practice is not limited to the walls of their clinic, but it's limited only by what they don't do. So we have an opportunity to really extend health care to every Iowan. And we are just 2 votes away in the Iowa legislature to guaranteeing that every child in this state is covered by health insurance. 2 votes. And we're not just talking about almost all children. The bill that we have will guarantee children, even undocumented children, to having health care that they should have. That part won't be easy, so we may ask your help in getting that done. But we will do more than any other state at the end of this legislative session. And we're going to do more for adults as well. And so we're attempting to do things that we've never asked my colleagues to do in the past. And we're going to push the envelope, and we're going to continue to do what is expected from you. This last year, the 4 men up here have been given responsibility to make sure that we don't have workforce shortages. They're responsible for coordinating a variety of councils, of participating in research and getting back to the legislature ideas on how we can make the reality of health care for everyone. Now let me just close by saying, when people talk about universal health care, we mean just that, health care for all, not a single payer system. Quite frankly, I don't care how many payers there are. What I care about is that all of you have access to affordable and quality health care, because when you have access to health care in this country, you then have a more healthier life, you have a better life, you have a higher quality life. And in all that we do, you have a life that you can enjoy. And for some, I think everybody here knows somebody who is sick, who needs that help. And those that are getting it are probably feeling better, at least satisfied that they have a fighting chance to survive. But for those children and those adults that don't have that access, that insecurity is unreasonable. So I want to thank you for being part of these kinds of dialogues, and for the Iowa Caregivers Association who continues to press for the goal that all of their workers are fairly treated, have health care, are paid well, and that mostly they provide the best services to their patients. Thank you.